In the field of hematology, chronic lymphocytic leukemia, commonly referred to as CLL, is the most common adult leukemia, posing challenges due to rising treatment complexity. You see, while patient outcomes have markedly improved in recent years, this progress has also introduced greater intricacies in managing CLL. Physicians frequently face critical decisions when patients encounter adverse drug reactions, more commonly known as ADRs, during CLL-directed treatment. In an ideal scenario, consultation with a CLL expert or a team of experts supports these decisions. However, this isn't always practical, as CLL specialists may be unavailable, for example, in their specific clinic, or physicians may be new professionals with limited connections. Meet Dr. Jones, a dedicated young healthcare professional facing these challenges while managing a drug reaction in one of his patients with CLL. It all started when one of Dr. Jones's patients experienced persistent diarrhea a few months after starting treatment. Dr. Jones needs to decide whether to cease drug administration or not, meaning that the next step would be to consult a CLL expert to aid him into making the most optimal decision. But unfortunately, for our Dr. Jones and others like him, due to lack of peer support, they quite often find themselves making these decisions alone. As a result, this lack of support can lead to the suboptimal care of their patients, with sometimes severe uncertainties. This is where PEDRO comes into play. PEDRO is an ADR-management digital platform connecting physicians and experts through peer-to-peer communication, enabling optimal ADR management decisions. With PEDRO, Dr. Jones is not alone in his decisions anymore, and here's why. Now, with PEDRO, he can simply create a case in order to request guidance on the patient's adverse reaction to a CLL treatment, and expert help is just a click away. This means that no matter the setting and the location of Dr. Jones, he can access a network of specialists to support him with his patient's ADRs. Pretty neat, huh? But how does PEDRO achieve this? Well, PEDRO actually has dedicated CLL expert users that investigate each case. They review, discuss, and work together on each case, ensuring each response meets the highest standards of care. Their collective expertise ensures a well-rounded perspective and assures physicians like our Dr. Jones of reliable guidance. With PEDRO, you're not alone in your journey. Expert support is just a click away. PEDRO is made possible through the support of our dedicated consortium members. Join us today. Visit our website and get the support you need to make a difference in the lives of your patients with CLL. PEDRO, empowering healthcare professionals to deliver the best care and enhancing the lives of patients with CLL. It's not just a platform, it's a promise.